This pandemic has been a struggle for everyone, from young ones till the oldest, from one single virus dominating all around the world, creating a massive impact, just like the increasing growth of teenage pregnancy. That despite of being in a lockdown together with strict protocols, there are still teenagers that becomes apparent unplanned. This issue made everyone worry since young teenagers should be studying, not engaging to any sexual activities. This pandemic is the behind reason for the closures of schools and universities, which means that students in our ages must stay at home, not roaming around, and are focusing such sexual behaviors. This will not only affect young teenagers but also the unwanted child and the parents. This paper will serve as an eye opener to everyone that pregnancy is not yet for young ones as it needs readiness, maturity, and a lot of responsibilities to make.
The COVID 19 pandemic started last 2020 globally, and the disease, being contagious in nature, demanded the need for physical distancing. Establishments were closed down, people were requested to wear masks in public, and countries from all over the world implemented lockdowns starting from March 2020. The lockdown had forced the citizens to stay inside with their families and other people that live with them. This includes women who live with their sexual offenders because they have nowhere else to go. Young adolescent girls are one of the most vulnerable in this time. Due to this situation, as well as other factors, teenage pregnancy has increased drastically after the implementation of the lockdown. Educating students is one of the main goals that the study is trying to achieve. Students are included in the age range that could possibly become one of the victims of teenage pregnancy. There are students that are currently going through teenage pregnancy right now from all over the world. It is telling that students should know more and spread more awareness about this issue to not only students but other age and societal groups as well. The study will also provide and suggest solutions from the perspective of students and what students can do to aid and minimize this risk.
Teenage pregnancy is one of the rampant cases happening nowadays. World Health Organization stated that this usually happens in marginalized countries where poverty, lack of education, and employment opportunities are being experienced by the citizen. There are a lot of factors why teenage girls are engaged in early pregnancy. Example of this is entering in a romantic relationship at a very young age. Very young age, lack of knowledge about the sex education, the curiosity brought by external influences, and there are several countries where girls are being pressured to enter marriage and bear a child at a very young age. In a news article from Philippines Daily Inquirer, about 62,500 500 adolescents who became mothers in 2019, alarming finding where the cases might be double in number on the implement of lockdowns.
Everyone is suffering in COVID-19, especially women in labor, with hospitals being always full with not just COVID patients, but also people in need. That sometimes, if not always, hospitals are overflowing with patients, those people in need. Having this existential crisis, women in labor, especially teenagers, more often of them are in poverty, will suffer because of the strict rule that we have, lockdowns, quarantines. Women, particularly teenagers, have no access in IUDs. Also, we have a strict rule for minors buying IUDs, which may result into, yeah. But, looking in a different perspective, COVID might help decrease the amount of teenage pregnancy around the world, not just in the Philippines, because of the strict lockdown. Especially minors are not allowed to go outside. That's all.
Pregnancy is an issue that must be addressed because it endangers the health of the conceiving women and the children they carry. It makes unprepared women be responsible for human beings, and it is a dominating factor in overpopulation and poverty. This pandemic has now become a tool for the number of teenage pregnancies to rise. Even before the pandemic, teenage pregnancy has been a problem for many countries, especially conservative ones, due to the lack of education or the unwillingness to educate them due to the fear of pushing them into these sexual acts. However, the unwillingness brought out the opposite effect, and instead, teenagers are exploring for themselves about these sexual acts. The Philippines is a Christian nation, and Christianity promotes conservativeness and purity. This means that sex education is taught in scarcely any institution, and even sex conversations are taboo. In the Global Girlhood 2020 COVID-19 on Progress in Peril, data show that there will be an overwhelming amount of increase in teenage pregnancies. There will be an increase of 1 million girls due to the economic and social impact of COVID.
Haan's clinics in Metro Manila, Bulacan, in Eastern Samar, women and girls can get free contraceptive implants. Despite the coronavirus pandemic, Dikhaan continues to work and offers free teleconsultation on weekdays. Meanwhile, FPOP has a number of clinics around the country that provide door-to-door sexual and reproductive health care. They also have their Facebook page, which are open for inquiries and also share information about family planning despite the pandemic. As the NGOs work hard to do campaigns, parents should also do their job in guiding their children in avoiding this problem. In other countries like Cameroon, an hour of sexual health training regarding sexual health behaviors is done. It was found that the incidence of pregnancy decreased to about 25%, from 9.5% to 4.6%.
Girls and young women also shared recommendations to ensure their inclusions and participation in COVID-19 response. Filipino girls and young women believe that the government, private sector, and civil society should work together. First is to provide mental and emotional support, including psychosocial and wellness program. Second is to provide assistance and guidance for parents and guardians to support girls and young women who are studying from home. Third is to ensure the access of quality education by improving internet connection and signals in the localities and rural areas. Fourth is to provide information about gender-based domestic online violence and access to safe reporting, grievance, and justice mechanism for the victim. Last is to provide access to a safe platform where girls and young women can report and speak up, volunteer, and contribute significant inputs to decisions and solutions in emergency. And last is to response plans such as the COVID-19.